Hello everyone, welcome to Joas Medical Diagnostics. We'll be talking about the signs and the symptoms that you can develop if you have a heart disease. These signs and symptoms can help you to find out the problems in the early stages and prevent further complications. Our heart pumps blood non-stop 24/7 throughout our lives. Every organ depends on the heart to deliver fresh oxygen and give blood to them. That's a lot of activity and pressure, so wear and tear is bound to happen, and certain activities can cause the heart to face problems at one point or another. In this video, we will not talk about specific problems themselves, but we will take a look at the signs and symptoms which these problems might present with. This will help you to be more vigilant regarding heart diseases and identify them early in your life. So, keeping that in mind, let's start with a simple question. What is a heart disease? Heart diseases are one of the leading health risks humanity faces today. According to the American Heart Association, more than 1 in 3 adults suffer from heart diseases, and according to the WHO, around 18 million people die each year from heart diseases, which is estimated at 31% of all deaths worldwide. Here, we must clarify one thing. Heart diseases is an umbrella term that includes heart failure, coronary artery diseases, arrhythmias, angina, and other related heart infections, irregularities, and birth defects. Now, keeping in mind that the heart plays a very crucial role in our survival, it may seem that something so serious should have warning signs, but that is not the case. According to the Center for Disease Control, CDC, 50% of people who die from coronary heart disease didn't even know they had it because of lack of the symptoms. It is possible to develop a heart disease without knowing it as you go about your daily life. So it's important to know that the early signs and the symptoms of heart diseases as well as the risk factors so that you can get treatment early and prevent more serious heart problems. Let us first talk about what are the risk factors for developing heart diseases. According to the Center for Disease Control and Prevention, both men and women have 3 or more risk factors for heart disease. Let's take a look at a few of these risk factors so that you can modify and control them if possible. Number 1, age. Growing older increases your risk of damaged and narrowed arteries and weakens your heart muscles. Number 2, gender. Men are generally at greater risk of developing heart disease. The risk for women increases after menopause. Number 3, family history of heart disease increases your risk of coronary artery diseases, especially if your parents develop that at an early stage. Number 4, smoking. Smoking is a very important and modifiable risk for heart disease. Nicotine tightens your blood vessels, and carbon monoxide present in a cigarette smoke can damage their inner lining, making them to be more susceptible to arteriosclerosis. Heart attacks are also more common in smokers than in non-smokers. Number 5, poor diet is also a risk factor. A diet that is high in fats, salt, sugar, and cholesterol can contribute to the development of heart diseases. Number 6, uncontrolled high blood pressure can result in hardening and thickening of your arteries, which leads to narrowing of your vessels to which of the blood flows. Number 7, high level of cholesterol in your blood can increase the risk of blood formation and arteriosclerosis in the blood vessels of your heart. If you have diabetes, the salt will increase your risk of developing a heart disease. Both conditions share similar risk factors such as obesity and high blood pressure. Number 9, obesity is also a risk factor. Excess weight typically worsens other heart diseases and also increases the risk of developing arteriosclerosis. Number 10, physical inactivity and lack of exercise are also associated with many forms of heart diseases. And lastly, excessive stress is also known as a risk factor. A combination of risk factors may also signal impending heart diseases. For example, your risk of heart disease significantly increases if you have diabetes and high blood pressure. For an accurate assessment of your heart, arteries, and veins, echo heart scan, vascular color Doppler scan, and ECG studies, contact us at Joas Medical Diagnostics, Ikotun, Lagos, Nigeria. Now, let's look at the early signs of heart diseases. Usually, there are no signs of heart disease. It often presents unexpectedly in the form of heart attack or other serious events, but there are few important signs and symptoms that can help you to recognize heart problems before they become serious. In early stages, symptoms can develop that seems like mere annoyance may come and go. For example, you may have a very short episode of arrhythmias, which is basically an irregular heartbeat. You can experience difficulty in catching your breath after moderate physical exhaustion like walking up a flight or stairs. You can develop a sense of discomfort or squeezing in your chest that lasts for more than 30 minutes to a few hours. Unexplained pain in your upper torso, neck, and jaw is another early symptoms. A heartbeat that is faster, slower, or irregular than usual can also be a presenting symptom. You can also experience an episode of dizziness or fainting. Heart diseases that involves your blood vessels are often signaled by chest pain, also known as angina, shortness of breath, extreme fatigue, irregular heartbeats, and you can also experience symptoms in your hands and feet such as tingling, numbness, coldness, or weakness. These symptoms can be signs that your blood vessels have narrowed. This narrowing, which can be caused by blood buildup, which makes it more difficult for your heart to circulate oxygenated blood throughout your body. Similarly, heart diseases caused by an infection of the heart can include symptoms like fever, shortness of breath, weakness or fatigue, swelling in your legs or abdomen, changes in your heart rhythm, dry or persistent cough, skin rashes or unusual spots. Now, let's discuss about some signs of a heart attack. Myocardial infarction, also known as a heart attack, occurs when the heart disease reaches a point where the blood that flows to the muscles of the heart decreases. It becomes so low that the heart is unable to meet the energy demands of the muscles of the heart itself. The most common sign of a heart attack is chest discomfort that includes tight squeezing, intense pressure on your chest, which may or may not be associated with chest pain. The discomfort may also be present in your arm, back, neck, abdomen, or jaw. During a heart attack, you may have shortness of breath, profuse sweating for no apparent reason, nausea, and lightheadedness. Knowing the signs of a heart attack is one of the most important things you can do to safeguard your cardiac health. Your ability to recover from one of these events depends on how quickly you receive treatment for them. It can be difficult to determine if you experience symptoms of a heart attack. Never ignore any symptoms as normal. Always seek medical attention if you are concerned about any symptoms that you have. It is crucial to reduce your risk factor for heart disease, whether you have symptoms or not. Schedule regular checkups, even if you think your health is excellent. Establishing a baseline for your health will help you and your doctor address any concerns that arises in the future. Reducing risk factors and modifying your life habits will go a long way in decreasing your risk of suffering from a heart disease and also lessens the impacts if you already have one. An echocardiogram or echo is a scan that is used to look at the heart and nearby blood vessels. It's a sort of ultrasound scan, which means a small probe is used to send out high frequency sound waves that makes echoes once they bounce off different parts of the body. These echoes are picked up by the probe and turned into a moving image on a monitor while the scan is carried out. An echocardiogram may be requested by a cardiologist or any doctor who thinks you might have a problem with your heart. The test is usually done at a hospital or a clinic by a cardiologist or a trained specialist called a cardiac physiologist. Although it has a similar name, an echocardiogram is different from an electrocardiogram, also known as ECG, which is a test that is used to check the rhythm and the electrical activity of the heart. An echocardiogram can help diagnose and monitor certain heart conditions by checking the structure of the heart and surrounding blood vessels, analyzing how blood flows through them and assessing the pumping chambers of the heart. An echocardiogram can help detect the following conditions. It can be used to detect damage from a heart attack due to blockage in the coronary arteries, compromising the blood flow to the heart muscles. It can also be used to detect a heart failure where the heart fails to pump enough blood throughout the body as required. It can also be used to detect a congenital heart disease where this is the birth defect that affects the normal functions of the heart. Also, problems with the heart valves such as rheumatic heart diseases. It can also be used to detect cardiomyopathy, where the heart walls become thickened or enlarged, compromising the pumping actions of the heart. It can also be used to detect an endocarditis, an infection of the heart valves. For an accurate assessment of your heart, arteries, and veins, echo heart scan, vascular color Doppler scan, and ECG studies, contact us at Joas Medical Diagnostics, Ikotun, Lagos, Nigeria. An echocardiogram is also helpful in deciding the precise treatment for a certain condition. There are several ways an echocardiogram can be carried out, but most people will have a transthoracic echocardiogram or TTE. You won't usually need to do anything or prepare for the test unless you are having a transesophageal echocardiogram. For a TTE, you will be asked to remove any clothing covering your upper half before lying down on a bed. You may be given a hospital suit to cover yourself during the test. When you're lying down, several small sticky sensors called the electrodes will be attached to your chest. These will be connected to a machine that monitors your heart rhythm during the test. A lubricating gel will be applied on your chest or directly to the ultrasound probe. You will be asked to lie on your left side and the probe will be moved across your chest. The probe is attached by a cable to a nearby machine that will display a record of the image produced. You will not hear any sound waves produced by the probe, but you may hear a swishing noise during the scan. This is normal and is just the sound of the blood flow through your heart being picked up by the probe. The whole process usually takes about 15 to 60 minutes and you will normally be able to go home shortly after the procedure. There are also several types of echocardiograms available. A transesophageal echocardiogram or TOE, where a small probe is passed down the esophagus into the stomach. A stress echocardiogram, an echocardiogram carried out during or just after a period of exercise on a treadmill or exercise bike, or after being given an injection of a medication to make the heart work harder than usual. A contrast echocardiogram, where a harmless substance called the contrast agent is injected into the bloodstream before an echocardiogram is performed. This substance shows up clearly on the scan and can help create a better image of your heart. The type of echocardiogram you will have depends on the heart condition being assessed and how detailed the images needs to be. For example, a stress echocardiogram may be recommended if your heart problem is triggered by physical activity, while the more detailed images produced by a TOE may be more useful in helping plan heart surgery. The images from the echo will usually need to be analyzed before the results are sent to the doctor who requested the test. Your doctor will then discuss the results with you during your next appointment. So, are there any risks or side effects? A standard echocardiogram is simple, painless, and a safe procedure. There are no side effects from the scan, although the lubricating gel may feel cold and you may experience some minor discomfort when the electrodes are removed from your skin at the end of the test. Unlike some other tests and scans such as X-rays and CT scans, no radiation is used during an echocardiogram. For an accurate assessment of your heart, arteries, and veins, echo heart scans, vascular Doppler scan, and ECG studies, contact us as Joas Medical Diagnostics, Ikotun, Lagos, Nigeria. So friends, with this we have come to the end of this video. We talked about the various signs and risk factors for heart diseases. This is a series of video about signs and symptoms of various diseases in our body. Comment in the comment section below and tell us what topic you would like us to cover next. We are Joas Medical Diagnostics and committed to bringing you the latest and updated content. If you like what we do, support us by sharing our video with someone whom you think might find this useful. Thank you so much for watching and stay safe.